So nursing care of children with infectious diseases, we are basically managing the symptoms and preventing any complications such as dehydration. Again, especially, they can get very sick and very dehydrated early, the younger that they are. Again, a lot of the body aches and flu-like symptoms and fatigue, etc., we want to make sure that we keep that fever down. We don't want them to have febrile seizures, so we can use acetaminophen for that. And again, we want to keep them hydrated. We want to make sure that they're not getting dehydrated. That's the most important thing to prevent. So this slide shows you some of the causes of dehydration, and especially you can see the bacterial gastroenteritis that we just talked about, food poisoning. Those are some of the things that directly associate here with the infectious diseases that we're talking about. It's really important and nice to review concepts that we've talked about a long time ago. So again, this is just the pediatric differences for fluid and electrolyte imbalances. Remember the proportionately larger extracellular volume. They are very vulnerable to fluid volume changes, and they can dehydrate very, very quickly. They have a higher metabolic rate, so that causes them to lose more electrolytes and nutrients and burn calories and lose volume quicker as well. They do have just a greater water intake need in general. So all of those things together, hopefully you can understand that we're really watching closely for dehydration in this age group. Again, assessment of hydration status is totally review for you, but making sure we're looking at mucous membranes, making sure when we say level of consciousness in the pediatric population, it's not like we, can ask them, state where they're at, etc., and their name and birth date. So really looking at having the parents also tell us if that infant or newborn or young toddler is acting like themselves or not. Are they very lethargic? Are they listless? Are they little limp noodles? Those are all things that we're watching for as far as the level of consciousness and mentation and energy level, I guess. Obviously, body weight, we talked about measuring dry diapers and wet diapers. If we're actually in the hospital on an ACRD, I know that's how we'll do that. And just also, if they're crying and they're not having tears, they have very damp diapers. This is not normal for this age group. So management of dehydration, of course, is fluids. That's the most important. Oral fluids, IV fluids for rehydration. If IV fluids, they'll use an isotonic solution. A 0.9% sodium chloride or lactated ringers will be the best fluid of choice. We can replace it rapidly. Still watching for signs of fluid volume excess then, but we can, if they have working kidneys, we can flush them pretty good with fluids safely. And then again, the oral rehydration as well. Try not to have a lot of sugar because that can worsen the diarrhea, but whatever it takes to keep them hydrated is what we will do. Additional treatments for infectious illnesses that again are very fundamental: the acetaminophen, the ibuprofen. Typically no aspirin products for young people. Again, making sure we have the right amount of clothing, that we don't have them bundled up too tight, too hot. I mean, if they are running a fever, even though they feel chilled and want lots of blankets on them, we really shouldn't have them bundled up. So tepid waters, again, when they're taking baths, to have it be more of a tepid, not cool, not hot, but just neutral, I guess, temperature for that. Sponge baths, etc. Again, generous amount of fluids. Any of the medications that are treating their particular problem, such as antiemetics, antidiarrheals. But again, we do have to be careful in young children, typically, and depending on what we think that they're ill with, our body is vomiting and expelling in stool the microorganisms. So in some cases, we don't want to stop that process. We need them to actually get it all out. And so there would be recommendations for various different types of organisms on that. So not going to talk about all those, but just so that you're aware. And then again, administration of antibiotics, antivirals, and making sure that we keep that skin intact. And that's really, really important for all age groups, but definitely for the infant and young children. So everybody is aware how important hand hygiene is each and every time. And yet when we do hand hygiene audits, we're not at 100%. That always floors me. I say, how can we not be at 100% with hand hygiene? How can we not every single time foam in and foam out? So I'm not really sure, but we're making progress. We're getting there, but you need to do your job. Every single person needs to do their job. Only you know what you're doing, whether you're washing both in, to, and from. I think sometimes it gets tempting if you're just walking in to just say hi and not really touching any surfaces and all of that. And while you may know that you didn't touch anything or contaminate anything, that's not the point. The point is just to do it. It doesn't take but a second to do it. So again, that hand washing is critical. Of course, no artificial nails, no polish, all of those things for infection control, no excessive jewelry. Some hospitals don't allow you any jewelry, or some areas of the hospital if you're in critical care areas or places in oncology where we don't want to transfer any germs on our jewelry either. And then also some places will have you put on your own uniform once you get there, so that we're not bringing anything potentially from home, and that we're not taking anything out with us. So we should be, laundering our uniforms and getting them off as soon as we get home as well, so that we're not bringing things home to our families. So there are several resources on the infection transmission precautions or isolation precautions. I have a table that I made for you on transmission-based infection control precautions in your study guide. I also did load the signage for all of the precautions that we use onto D2L if you want to take a look at those. Either way, you need to do your due diligence to study these, to know what they are. Hopefully you've had plenty of experience with them at clinical so that you're starting to get them down. Again, what is involved with what types of precautions am I using for, say, contact versus droplet, and then what are some diseases or examples of patients or patient conditions that would be needing that sort of precaution. Those are the things that you need to study, and those are the things that you should know. So I'm not going to read through all these slides, but it does list everything that's involved with standard precautions. The biggest thing is that this is based on the principle that all blood, body fluid, secretions, excretions, non-intact skin, mucous membranes, and everything is infected and can transmit infectious agents. So we have to treat all patients as if they are infected. All patients, all other things that we're coming into contact with. So there should never be a question, for example, do I have to wear gloves if I'm giving an injection? Well, yes, you're going to have exposure to a mucous membrane, or not a mucous membrane, but basically a skin area that is not intact, because you're breaking the skin with a needle to give the injection. So again, it's just fundamental thinking about what's logical. So it should be an automatic that we're using our standard precautions, and hand hygiene, of course, is included in that. So airborne precautions are going to be used for the microorganisms that can be suspended in the air for a longer period of time. So your varicella virus, the chicken pox, the herpes zoster, which is your shingles, the measles, and the tuberculosis. Those are kind of the most common. And I say most common, I mean they're not common, but they would be the ones that we may see or have exposure to that would be placed in airborne precautions. So in the hospital, they'll be in a negative pressure room, and then we are fit tested every year. We have to do a fit testing also to make sure that our face and maybe if we've lost weight, gained weight, or facial hair, etc., doesn't change, and that N95 respirator still fits properly. And then also it's nice to see how it fits if you wear glasses, because I know sometimes when I have my glasses on, I can fail the fit test, and if I have my glasses off, I don't. So you have to be aware of that, because whether you're wearing your glasses or not that day, and you had to have a fit tested N95 to go in a room, you need to make sure that it is appropriate, because you're protecting yourself. So the transmission-based precautions are probably the most common precaution that we have to implement at the hospital, so either droplet or contact. With the droplet precautions, this is where it's spread by respiratory, by coughing or sneezing. These droplets can travel a long distance across the room, so it's not that even right next to them, but they can travel and then land on the surfaces and be contaminated. So, we'll see primarily in the hospital, the most common for droplet would be your influenza and your RSV for the pediatric population, but influenza for sure. Anybody with suspected influenza will be in droplet precautions until ruled out otherwise. Contact precautions, of course, you're going to see the contact precautions primarily with our C. diff. Anybody that has like head lice, scabies, not that you see that a lot. Anybody with MRSA, VRE, those are some of the ones, the resistant organisms that we see most commonly to have people in contact precautions. Again, you can look for yourself what's involved with the droplet versus contact, but just wanted to mention some of the conditions also that are associated. So the next several slides are talking about the Ebola virus. I'm not going to speak to them. I don't believe this is something that you really need to know for NCLEX, but it is certainly something that we need to be aware of as community members and as healthcare providers. Here's some of the signs and symptoms for Ebola virus, and I do always like how they specify the early versus advanced. It's important for us to see some of the early signs and symptoms, which is typically just like headache and muscle pain and a sore throat. So if we were caring for somebody with Ebola virus that was infected, they would be standard precautions plus contact precautions plus the airborne precautions. So it shows you the PPE, that would be the personal protective equipment that would be utilized for Ebola. And this is also a good time then to make sure that you understand how to correctly don and doff the PPE. So I have included these slides to show you that, to make sure that you're doing it properly. And then this is the slide for removal of PPE. So again, you can review that on your own and make sure that you remember how to do that.